right, good morning, everyone. I'm Carol Gieske with the Elgin Area Chamber. Thank you for joining us today. I have 11:30 on my clock, so we are going to go ahead and proceed with our vaccine update with the Kane County Health Department and Michael Isaacson. But before we get started, I just want to say thank you and welcome. Thank you and for joining us this morning. We appreciate your time. We're committed to be with you until 12:15 today, so you can receive an update on the vaccine situation here in the Kane County area. I'm working with my colleagues up and down the Fox River Valley on joint programming. So I'd like to thank the Chambers of Commerce with Geneva, St. Charles, Huntley, Bartlett, Hampshire, Algonquin Lake in the Hills, Cary Grove, Batavia, Northern Kane County, and Kathy with VIA is with us as well today. So thanks to all of them for joining us. Before I introduce today's presenter, will you please mute your microphones during the presentation? We'll have time for questions towards the end of this. If you have any questions, please just type them in the chat box and Michael will be able to address them after his presentation. It is now my pleasure to introduce Michael Isaacson with the Kane County Health Department. Michael's been so available to our community organizations, to all of Kane County during the coronavirus, and we're just so pleased he could be back with us again today to present an update on the vaccination situation here in the county. So Michael, I'll turn it over to you.
Great. Thank you so much, Carol. Appreciate it. I'm happy to be here to share a little bit of an update with everybody and also answer questions or take suggestions that people have for additional things that the county can do as part of our response. I do want to say I'm as optimistic today as I've ever been. I think we're starting to make tremendous progress in getting vaccine out to people. So a lot of the more specific ideas that we've talked about over the last couple of months, we're finally starting to get enough vaccine in our community where we can be a little more targeted with who we're getting it to. So initially, we were really focused on trying to get to these big groups of people who were really clamoring to get vaccine. Now, I think we can be a little more surgical in our approach. So I'm just going to share my screen here. So I always like to start the presentation with just a quick update of where things are. So a couple of regional statistics that I'll share. So this is for Kane and DuPage County, just a relatively consistent data point that we like to highlight. This is test positivity. So that is out of all the people who test to see if they have COVID, what percentage are coming back positive. If I showed the last couple of months, this would be a very positive looking chart because just a couple months ago, we were up 18% of the tests coming back positive. Now we're down below 5%, which is very good. So I'm really pleased to see that number so low. Each of these little purple dots indicates a day where there was a slight increase in the positivity rate. So you can see, what do we have here? 6, 8. So 8 to 30 days, 8 to 31 days, we've had a slight increase. So even though I'm really happy about this, this is something we want to keep our eye on. But still overall, it's really positive. Another thing that's important to point out about this particular chart is we are seeing less people getting tested. A lot of the attention is on people getting vaccines, so we're having fewer tests done. So that can impact the amount of positive tests that we're seeing. But again, under 5%, that's really, really nice to see. Hospitalizations continue to look extremely positive. So only 2 days that we had increases over the past month. I know one of the hospitals I was talking to last week that during the peak had over 70, 75 patients in-house who were COVID patients. Now they have less than 10. So that's fantastic. Way fewer people in our ICUs, way fewer people on ventilators. So these 3 charts I'm showing here, test positivity, more people test positive. Ultimately, that leads to more people in the hospital. And then the third chart I'll show is looking at the ultimate measure we want to get rid of is the number of deaths. This chart is specific to Kane County, and it shows from the summer to current. So you can see the kind of the peak that we had here in late December, early January. Again, talking about how these charts are connected. We started to see positivity increasing here in late October, early November. Eventually, those people are showing up in the hospital, and eventually we were seeing more deaths. Right now, we've had a nice steep decline, which has been good, but we're still losing one Kane County resident to COVID every day. So that's something that, again, we're not out of the woods. We want to keep our focus. And even though everybody's sick of this, and even though I've been saying that, we've all been sick of it for about 10 months now. We have a little ways to go until we're done with it. And unfortunately, we're seeing some younger people who are losing the battle with COVID as well. So unfortunately, we had someone who was in their 30s in Kane County that was just reported who passed away. So this is affecting everybody. Nobody should feel like they're immune. Unless they're vaccinated, which I'll get to now. So on a more positive side, this website, if you want to track this kind of thing, is where you can see the information about what's happening with the data. I'm really excited to say that on Friday, we sent out a press release that we had passed 100,000 shots administered to Kane County residents. And I was really excited because that increase, and you can see here each of the blue lines is reflecting the daily vaccines that are administered to Kane County residents. Friday, we celebrated going over 100,000. This is yesterday's data. So as of Tuesday, we're already almost up to 120,000. So that's a 20% increase in the number of shots that we've given in just like 3 or 4 days. So again, our capacity is finally getting to such where all the frustration, all the struggles that people have had when we didn't have enough vaccine, we're finally starting to address that and get to a point where we're able to pick up some speed here. So here we're averaging just under 4,000 doses a day, and you can see that's been on a nice increase with the new Johnson & Johnson vaccine that's coming out, or you may hear it referred to as the Janssen vaccine. So it's a Janssen vaccine manufactured by Johnson & Johnson. That's the 1-dose vaccine. The health department hasn't received it yet, but we hope to be getting it in the next week or so. But I do know that, for example, Walgreens is administering Johnson & Johnson vaccine currently. So it is starting to make its way into our community, which is really great. This chart I go over on every presentation, so I won't spend a lot of time on it. I will point to the bottom though, where we have this new expanded 1B+ category, which includes people with health conditions, includes people who are smokers, includes people who are obese, includes people who are pregnant. So that is great because there's a lot of people who are at risk for serious illness. So it's great that we're able to get vaccine to them now. It also adds additional pressure because now it's even more people who are trying to get a limited resource. So when you take all of these groups into consideration with the 65 plus and all these frontline workers that were already on the list, it's probably a majority of the adults in Kane County are now eligible for this because they meet one of these criteria. So a lot of pressure, a lot of demand. Again, it's getting better, but still we don't have the supply yet to meet this. Looking quickly at the demographics, we have provided at least a first dose to 54% of those that are over 65. So that's good that we're protecting those who are most at risk for serious illness. Looking over at race and ethnicity, we still have pretty uneven distribution and uptake. So only about 11% of the shots have gone to people who are in the Latinx community, even though that population makes up over 30% of Kane County residents. I will also point to this kind of purple bar here, and I'll make the slides available to anyone who's interested. The purple bar is the African-American population, where about 3% of our shots have gone, even though that group makes up about 7% of the population. So we don't quite have equity yet. We have some specific outreach going, and we have groups where we know we're going to need to do more education because there's mistrust or just kind of maybe a natural avoidance to interacting and getting vaccines. So I think that's getting better, but we have a lot of education yet to do. I'm going to show a quick 1-minute video here just to highlight some of the things we have going on. There's going to be footage from a clinic that we just ran at Elgin Community College. specifically for seniors, as well as a clinic that was run by VNA Healthcare in the city of Aurora, specifically working with African American pastors. So I believe I shared my sound, so this should work here.
Today we are at a mass vaccination clinic at Elgin Community College in Elgin, Illinois, where we will be vaccinating approximately 3,000 people over the course of 2 days, today and tomorrow.
It's so important for the African American community to get vaccinated.
I would recommend everyone to come and get it.
And I was very excited about receiving the vaccine.
Very well organized, total of about a half an hour from the time we got up to the door and got our shot, and we're done.
So we are going to continue to try to put out more information so that people know what to expect at clinics. And also we want to show people kind of the amount of work that's been going on. So there's a lot of people in each community who are dissatisfied that they haven't been able to get a vaccine yet. And it's kind of the grass is greener type of thing. I work closely with my colleagues in the collar counties, and they hear the same complaints as we do. There's a lot of people who tell us, why aren't you more like DuPage or Lake County? We have been running clinics every week and vaccinating thousands of people. I think we just need to do a better job telling people about that. Most of our work so far has been targeted to specific groups. So whether that's healthcare, whether that's senior, whether that's educators, whether that's specific businesses. So we haven't put out the big broad announcements, but I'll talk about in a moment. We have some exciting things in the works right now, where we'll be able to have more consistent vaccine and easier for people to sign up for. One group that we do want to make sure that we're addressing is those people who have trouble with technology. So we know that this whole system is based on being able to navigate all kinds of websites to be able to get to an appointment. So we have worked with these organizations over here on the right side of the screen. They've stepped forward and said that they're willing to help sign people up over the telephone. The easiest thing for people to do is they can call 211. So if you have employees or family members who maybe struggle with technology, if they call 211, they will be connected with an organization that may be local to them, wherever they live. They can help them to register. In addition to that, at several of our clinics, we've set aside specific spots for these organizations to sign people up. So as you can imagine, and as you've seen in the news over the last couple of days with the United Center work, as soon as these links go live, then the spots are filled up instantly. So we're setting aside time where we let these groups work with people over the telephone, sign some people up, and then we send the link out live, because then it's filled up instantly. I do see a question in the chat for 211 that is available in Spanish. So anybody's able to call and get that assistance. And I do want to kind of give a little praise. Both Age Guide and Senior Service Associates have been fantastic to work with in terms of trying to address the needs of our senior population. So they've been great partners in this. We still encourage people, if they're able, to go and create accounts with these different pharmacies. Our take on this is you can wait for the health department, you can wait for your doctor, that's fine. You will get your shot. If you want to take a little extra time and try to get the shot sooner, there's a lot of opportunity. And every day, as I mentioned, there's more opportunity because the pharmacies are getting more. I just saw in the Next Door Neighbor app last night that people in my neighborhood signed up with Walgreens this weekend and have shots this week. So supplies starting to pick up, and hopefully this dead end that we've been sending people to, or the perceived dead end where we're asking them to contact the pharmacies, but there wasn't enough vaccine, that's getting a little better. Still not perfect. You're not guaranteed that you're going to just sign on and get an appointment, but it's getting better. A couple things that I suggest for people. We do have weekly updates that come out from the health department, so you can sign up. It's in English and in Spanish. The communications go out in both languages. So I encourage people just to stay informed, to contact us and get registered for that. We do have the health department website where we include links to the different pharmacies. There's starting to be a little more transparency from the state and the Fed in terms of where vaccines going. But in most cases, I don't know when CVS gets an order. I don't know when Walgreens does. I don't know when Osco does. So there's different clinics that are being set up around the community that we're not necessarily involved with. I see it as a positive because it means we're getting vaccine to more people. But again, it's not centralized, and it's just not set up to be centralized. So moving forward, getting shots to people, but you may have different opportunities. And I think this is pertinent to employers because working with a manufacturer, working with a factory, we may have better luck working with you and a pharmacy to bring somebody on site to actually administer the vaccine. So I just want to kind of put that out there. We continue to look at different specific groups. So whether it's senior housing, whether it is manufacturing plants, whether it is churches, if we're trying to reach a specific demographic, and we're setting up small and large clinics in those places so that we can get vaccine to people. This slide, and again, I think I've been saying this for a while, finally the supply and predictability are improving. We're now getting a 3-week projection from the state, which helps us tremendously with our planning because up until about a week ago, we would just on Wednesday, we would find out what we were going to get the next week. So it made it very hard to plan because the number of doses could fluctuate by thousands. So at least now we have an idea of what's going to be coming to us. I mentioned that the direct shipment to the pharmacies and clinics has already started. And then the county board just approved yesterday for us to enter into a lease at the Sam's Club in Batavia. And we're working with the National Guard to try to bring resources in so that we can just have a standing clinic. This is going to be great because not only is there going to be a consistent place people can go, but it's going to allow people to make appointments into the future a little bit more. So instead of hitting dead ends, they're going to be able to move forward and get an appointment, say 2 weeks from now, 3 weeks from now. Also, that's going to relieve a little bit of pressure so that we can do more of the targeted work, so that we can work with the churches, we can work with more employers, we can get in and try to touch those specific groups. So we're very excited about that, and more details about that should be coming out in the next couple of days. Just a quick note on equity. One way we're trying to reach our underserved populations is by working with our federally qualified healthcare centers, which include VNA, Greater Elgin Family Care Center, Aunt Martha's Community Health Partnership. Some of your employees may get their healthcare from there. These are countywide. These are very large healthcare providers, so they've been fantastic partners. We're also coordinating on-site clinics in partnership with the state and their health equity team to bring mobile clinics to sites. So there's multiple manufacturing plants and meat processing plants that we've worked with over the last couple of weeks. We're really focused because we've had a relationship with many of these businesses who've had outbreaks that, due to the nature of the work, have been hard to manage because people are doing work that requires them to be face-to-face or shoulder-to-shoulder for extended periods of time while they're on the line. So we are working through that list right now. But again, I think there's going to be more opportunity for more employers as we move forward. We are working with partners to do some of these specific outreach events for specific groups. We hosted the large senior event. VNA in the city of Aurora did an event specifically for the African-American churches that I mentioned. So some of those smaller targeted pockets are being addressed. And then, as I mentioned, we'll have more targeted work in the future. And sorry for how busy these slides are. I just wanted to copy this information that just came out from the CDC this week about fully vaccinated people and what they're able to do. Just as we projected, we're going to continue to see a relaxing of the guidelines for people who are fully vaccinated. A few weeks ago, they said if you're fully vaccinated, but you're exposed to somebody with COVID, you still need to quarantine. Then they changed it and they said, well, you don't have to quarantine, but you need to really monitor yourself for symptoms and be careful. Now, finally, this week, they've said, okay, if you're fully vaccinated, here's a couple things that you can do. You can gather indoors with other fully vaccinated people without wearing a mask. So that's fantastic. It's starting to get a little bit of normalcy back to people. You can gather indoors with unvaccinated people from one other household. So for people who've been socially isolated, a lot of grandparents who haven't been able to see their families, Now people can start to mingle again, trying to be sensible and keep the group small, but we're allowing people to, at least with the guidance, to get back into visiting some friends and family. If you've been around somebody who has COVID-19, so what we would have quarantined you for, now you don't have to quarantine, you just have to watch yourself for symptoms. And then we still are asking people when they're out in public to wear a face covering. We're still collecting data about how a fully vaccinated person may still be able to transmit disease to others. So we do want to still be cautious as more people are vaccinated in the community and as more data comes in about how protective these vaccines are. I think we're going to be able to continue to relax these standards. But just a couple things: avoiding crowds, avoiding travel, watching yourself for symptoms. And then I think this was a note I just wanted to include for this group: follow the guidance of your workplace. So if you have employees who are vaccinated, depending on the type of business you have to make a decision for yourself. If you have kind of front of house staff who's vaccinated, do you want them not wearing a mask if all your customers are coming in and then they're complaining to the health department that person's not wearing a mask? So, we just want to make sure, even though it could be safe, we leave it up to the discretion of your organizations to make sure that people are following the appropriate guidelines that you're setting forth in your business. And with that, I always end with just, again, please continue to wear a face covering, continue to social distance whenever it's practical. And with that, I'll open it up to questions.
Michael, a question: is the 211 number only for seniors, or are others able to access that telephone number?
Yeah, anybody can call 211 and get information. It's a great resource for a whole variety of social service needs. We're really focusing on the technologically challenged people for this, because really we're giving people an advantage to get a shot because there's a disadvantage because they struggle with technology. If we start having everybody on Facebook say, hey, I know a way to get a shot, just call these numbers and tell them that you don't have a computer, we'll have to shut the whole thing down, and unfortunately it'll ruin it for everybody. So the competition for vaccine is something that we're continuing to monitor, definitely.
Another question regarding on-site vaccination process at a manufacturing facility. Is there a minimum number of staff in order for you to come in and do that kind of vaccination on site?
Yeah, what we've been looking at right now is at least 100, but as more vaccine becomes available, which again, this could change just in the next couple of weeks, there should be more opportunity. And I'm speaking for the health department. If you call OSCO and they say they're willing to come over and vaccinate 50 people, that's great. And I don't want to stand in the way of that.
Thank you for that response. The deck of the PowerPoint that you had available, you'll be sharing that with us, and we can share that out?
Absolutely.
Excellent. Good. There is a question from the vaccination at Mooseheart. Didn't see it on the Kane County site on April 1st. Is there going to be more information or more vaccination opportunities at Mooseheart?
Now with the Batavia location, I think that's going to be pending. So we'll be doing second doses at Mooseheart most likely. But I do want to put the caveat: if we have a 100,000 square foot building that we're renting, there's a chance that we'll just move everything over there. But that's still pending.
And you talked about the Batavia location. Could you just give folks the information on where that's located?
Sure, and it's all pending right now. So the final details will be coming out soon. The county board just voted to approve entering into an agreement with the old Sam's Club on Randall Road there in Batavia. So the timing for when clinics would start and the additional information about potential National Guard resources, those should be available in the next day or two, I would expect.
I also did see from the newspapers today that there's also a potential site in Carpentersville at the northern end of the county. So we do have both two locations within the county and proposed at this point in time.
Right.
A question about the drop in the number of COVID cases in Kane County, as well as Kane County's positivity rate. What do you attribute that to, the drop?
Viruses are interesting things. So my belief is that this is attributable to starting to be vaccines now, because we're 100,000 shots. We're starting to get a decent number of people who've at least had one shot. also natural immunity, because we had so darn many people who were sick over the winter that those people should have some protection for a few months and maybe longer. Again, we're still learning about natural immunity and how long the vaccine is going to protect us. And then I think there's just some natural ebbs and flows with pandemics like this, that regardless of intervention, you can see some increases or some waning of numbers. But I think for the most part, the natural immunity and the number of people we're finally starting to get vaccinated is going to continue to help.
So we've gone from 1A to 1B, and when do you think, I know it's all projection, but mass vaccinations for 1C and all the rest of the folks, those entrepreneurs who are working from their home, how do we anticipate that vaccination extending into that world?
Yeah, there's two caveats with that. One, will we get to 1C, or is there a 1B plus plus? I don't know as those kind of things are announced. But the main thing that's going to dictate that is vaccine supply. So if we're able to start giving out 100,000 doses in a week, then we're going to get there quickly, right? I mean, and what I'm saying is common sense. But unfortunately, if we only get 10,000 doses a week, it's going to take us a long time. And I can tell you, like for the week of March 22nd, even though I'm very optimistic and the pharmacies are getting a lot of doses, we're only scheduled to get 1,800 new doses of Moderna. So that's new first doses for people. So even though a lot of things are improving, that same week we're going to get 7,000 Pfizer, but the health department is currently not getting the massive amount of vaccine that we would like to be getting yet. But everybody keeps saying it's coming soon. The word vaccine tsunami is what the state keeps telling us. So we're hopeful.
So it really is advisable for anyone interested to not only sign up on your website for that information coming forth, but go out to all of the different vendors and sign up for the list, because once you sign up, you can always decline. Is that right?
Absolutely. Yeah, absolutely.
So the Walgreens and the Myers and all the different stores, Walmarts within Kane County, certainly have a lot of sites that are offering this, and that will just increase chances for folks within these two levels to receive that kind of information if those vaccines are available. 1,800 for that week is not encouraging to hear by any means, Michael.
No, and especially if we set up a clinic where we're able to do 2,000 or 3,000 a day, if we only get 1,800 for the week, that's not grand. And out of our supply, we share with all the hospitals, we share with the clinics. So this is not just what the health department's going to be administering, but we already have commitments to other organizations as well.
So I posted your information when we started, your contact information and your phone number down at Kane County Health Department. If businesses who are listening are interested in contacting you to be put on a list or some sort of indication that they would like on-site testing, is that the best way to do so?
Yeah, this is something we've struggled a little bit with, and I know we've had a lot of discussion. I don't want to set false expectations, so I don't want to get a list of 600 employers when I know we may only realistically be able to get to a much smaller number than that over the next few months. And also, we're completely overwhelmed with phone calls from every sector, whether they're seniors, whether they're businesses, whether we're getting beat up about health equity issues. So if we can coordinate that, we have a list of places with outbreaks that we're working with right now to try to protect people who are currently struggling with some illness. So I would hold temporarily on telling everybody to contact me, and I'm just trying to be transparent with that, because I know, and this goes for friends, family, whoever, everybody is an essential worker. I've got a stack of letters from businesses that say that they're essential. So I'm not going through that kind of screening process with everybody. But if we can get to the point where we have more vaccine, then I think it's going to be better for us to be able to reach out through the chambers and through the Valley Industrial Association to reach the members. And if people think that's horrible, let me know. I just don't want to put you on a list and then not talk to you for 3 months.
Here's another question. Are you concerned that people are not going to go get tested for COVID anymore in anticipation that they'll be getting vaccinations soon?
Yeah, absolutely. So we definitely want to keep pushing people to get tested, and in businesses, in schools, any place where people are coming together. If they're not vaccinated yet, we want to make sure that testing is still widely available. So our test numbers are not bad right now. We're still testing thousands of people a day, but it's just a little bit lower than it was previously. So we don't want to lose that. That's a great question. We just don't want to lose that kind of in the churn of all the vaccine anticipation.
We have gone through the questions on chat. Are there any other questions from today?
This is Wei. I have a question. For manufacturing, that's what my company does. We don't have more than 100 people as regular full-time employees on the sites, but we also employ a lot of temp labor. So would that count in the head count?
Sure, and the number is not a hard, fast number on the 100. That's just where we're looking, because we've been relatively limited in how much that we've been able to do. If we get rolling with a site that we're able to do 6 days a week, say at Sam's Club, which I anticipate we'll be able to do, we're also going to free up resources then that would be able to go to more places on site. So I wouldn't worry so much about how we're defining the head count. I think it's just we need more vaccine, then we can do more of that outreach.
Michael, you have the staffing available for the application of the vaccines. Do you need volunteers to assist in the process anywhere along the way?
I think as we look at what's going on at Sam's Club, we may be able to reach out and engage people. There's also more localized work that's going on with communities. For example, the city of Aurora has really, in a positive way, gotten aggressive now that the pharmacies have vaccine, where they're reaching out to them and they are scheduling clinics. I know they have one this week with Walmart, or not with Walmart, with Walgreens, where they're going to be administering the Johnson & Johnson vaccine. They're doing that on their own without us. So I think that's great. And in that case, the city may say, oh, we need some additional people to help with registration. So they're looking at local businesses and service clubs, et cetera. From the health department side, I think, especially with the National Guard resources, we do have a medical reserve corps that people can sign up for, and they've been invaluable for us over the past year, whether they're taking calls, giving shots, helping people register, et cetera. But that's a process where we go through and do background checks and TB tests and all that. So it's a little onerous for a group to just come into our process that way. But I'll definitely reach out to the chambers if that changes.
Thank you. Appreciate that. Another question is, have you heard anything about the occupancy rates for restaurants and banquet halls going to change soon? We all know that there are limitations there, but any information that you can share on restrictions being lifted somewhat?
No, I haven't heard anything. And again, this is another area where it would be pure speculation on my part. I get a lot of questions, just like as we move from 1B to 1C. We're in phase 4 now. When do we move to phase 5? Is there going to be a phase 4.1? That all is coming out of the governor's office. So I don't have any concrete information. The main thing is if we can keep driving these numbers down, I think that's going to help tremendously.
Wonderful. Well, our time is up. We are going to thank you, Michael, for your continued resources and excellent information that you're sharing with the business community on vaccines and updates that are available. We will try once again to schedule you in a few weeks to get further information, but thank you for your time, for your expertise. If anyone has any questions, please get in contact with your local Chamber of Commerce. This has been recorded. We will be posting it, sending it out to all of the chambers this afternoon, and it will be posted, so you'll have that information available. If you have any specific questions, I'd recommend that you would get a hold of your contact at your local chamber, including our Elgin Area Chamber, Geneva, St. Charles, Huntley, Bartlett, Hampshire, Algonquin, Lake in the Hills, Cary Grove, Batavia, Northern Kane County, and VIA. So thanks again, Michael. Thanks to the rest of you for joining us on this beautiful, sunny Chamber of Commerce Day. We're going to totally take credit for this warm, sunny spring day, if you don't mind, and recognize that there are many of them ahead. So stay well, everyone. Thank you for joining us. Take care.